Welcome to Digital Mental Health Musings, a podcast series from the E-Mental Health in Practice initiative, providing health practitioners with the latest news and developments in digital mental health services and resources. MPRAC acknowledges the Turrbal and Yagara people, the traditional custodians of the land on which we bring you this conversation. We acknowledge elders past and present and honour their continuing connection to land, culture and community, and that it's these connections that are intertwined in Indigenous mental health and social and emotional well-being. We acknowledge the strength and resilience of all First Nations people and communities since colonisation of their unceded lands. Hello and welcome to Digital Mental Health Musings. I'm your host, Dr. Tania McMahon. And in today's episode, we are joined by Project Officer Angela Sheridan from our partners at the WellMob team who've created the amazing WellMob website. And we're also joined by social worker Rebecca Pevitt. So Beck, welcome to the podcast. We're so pleased to have you on here today. Today's episode's being recorded just after NAIDOC Week, which every year is a time to celebrate and recognise the history, culture and achievements of Aboriginal and Torres Strait Islander peoples. And we thought it would be a really great opportunity to talk about the work that WellMob is doing and also what Indigenous knowledge and culture can teach us about mental health and digital mental health. So to start, Beck, can you tell us about yourselves, who you are and where you're from?
Yeah, sure. Thanks, Tania. So I'm Sheridan. I'm a Wiradjuri woman. I am born and raised here in Widjabul country, which is Lismore on the far north coast of New South Wales. And I work in the WellMob project, which is a website of digital resources for our mob.
Welcome, Ange.
Thanks.
Hi, I'm Rebecca Pevitt. I'm a social worker by trade. Currently, I work at New South Wales Health in a counselling role with the drug and alcohol team. Before that, we're a free and confidential service that provides counselling to community, person-centred trauma-informed counselling around substance misuse issues and what people can do around meeting their drug and alcohol treatment goals. Before that, I worked in non-government organisations and worked with drug and alcohol. So I've been in drug and alcohol about 9 years. I've worked in community day hab programs, so providing rehab in the community that fits in with sort of daytime hours, like not having to stay overnight, which helps a lot with mums and dads and people that are looking after elderly people, or they just can't afford, to give up their rental and go to long-term rehab. I've also worked in gambling counselling, which is, I think, the only non-substance related addiction in the DSM-5 now. So it's very similar beast, but also comes with a whole range of different issues. Yeah, so that's my background.
Oh, well, Thanks for joining us, Beck. It's a pleasure to have you both here to talk about mental health from an Indigenous perspective. One particular area of Indigenous culture that is woven throughout all of WellMob's resources is this concept of social and emotional well-being as the foundation for physical and mental health. And I'd like to start by exploring this more. So Ange, can you tell us about that framework, the social and emotional well-being framework, and how it's different from the mainstream concept of mental health?
Yeah, sure. So social and emotional well-being is a term that's used to describe our Indigenous overall well-being. It's more than just mental health in the way that it accounts for our connection with the world around us. And we're all interconnected. So self, community, country, culture, and our kinship systems aren't separate to self. We're all intertwined and interconnected. And there's been a model developed, which is the framework for social and emotional well-being. And the domains and determinants that affect those. So the things that I mentioned just before that make up an individual's social and emotional well-being, like culture, country, and kin, they're all protective factors of our well-being. And then there's social, political, and historical determinants that can affect that either by weakening or disrupting those connections. So I guess the main difference between SOUP, which is, I guess, our abbreviated term that we call social and emotional well-being, and mainstream mental health is that it is a holistic concept, and it isn't just issue or symptom focused. And understanding the difference of this concept helps to address the complex and interrelated determinants of health. And this difference highlights the need for Indigenous specific SUB content for our mob, because that holistic concept underpins our entire ways of doing, knowing and being, which is reflected in the resources that are made for mob and by mob.
Yeah, because people walking into the Western health system that we, mental health system that we have, you're viewed as, your issues are viewed as, pathology, problem, symptoms, depression, anxiety, things like that. So it sounds like the really big difference here is this big bird's eye holistic view of, well, what actually makes us healthy and well. And it's not just a collection of symptoms and, how we might typically look at mental health.
Yeah. And I think it comes more into like the treatment side of stuff or the healing side of things. So with a mainstream mental health service, it might be just, looking at the square that fits those symptoms and issues and treating that. But then for our mob, it's also then taking into account everything else that's in that holistic concept of social and emotional well-being and how those things can either negatively affect or strengthen a person's well-being. And that's sort of how we, I guess, aim towards, that goal of healing.
It gives you a roadmap for what's helping, what's hindering, and what needs to be addressed.
Yeah.
Yeah.
There's a really great video on the WellMob website. So as I mentioned earlier in my intro, it's a website that's collated of online resources specific for Indigenous social and emotional well-being. There's a really great 10-minute video on there that explains this concept of social and emotional well-being. And it is aimed at our health and community workforce that explains it in like a healthcare setting, and the things that can impact an Indigenous person's SUB, our social and emotional well-being.
Amazing. So there's a really accessible resource on there that actually helps unpack it for health practitioners, especially if you're not Indigenous and you want to know more about what it is, what it means.
Yeah. Probably explains it a lot better than what I did.
No, that's really clear. It's but it's really great to know that there's a really there's these really accessible digestible resources on there, because we're all time poor, and when there's big knowledge gaps like that, where you go, well, I need to know more about this, I'm just going to punch it into Google and see what comes up. It's great to know that there's these really targeted, this is what you need to know in this tiny 5-minute clip or 10-minute clip.
Punch it into the WellMob website.
Punch it into the WellMob website. Say goodbye to Google. Fabulous. And so with that framework, how does that translate to the digital mental health space? So what kind of advances have kind of been made over the last decade here, in the digital mental health space, and how has that actually changed the treatment landscape and what's available for Indigenous people?
Yeah, I think it's definitely broadened like access to this knowledge that, generally or traditionally would be really tightly held within communities. So nowadays, being able to record our elders and being able to record our stories of traditional practice and why we do the things that we do, especially when it comes to culture and country, they're parts of us that keep us feeling really well and strong. And now in this digital age where we're able to capture and record all of this information, it makes it more easily accessible for Aboriginal and Torres Strait Islander people to access to, especially, if we're living away from our community and family, if we're living off country, which is, living away from our homes, and that cultural and physical connection that we have to the place that we're from, we're able to kind of tap into that in a digital way that we get that same benefit of maintaining those connections and feeling that strength that we get from that. And it also allows, I guess, access for non-Indigenous people to hear these stories and gain these insights that more typically, they wouldn't have access to that knowledge.
Wow. So it's really extending the reach of this knowledge. So to Indigenous people who may not have access to it or easy access to it because of where they live or other factors or barriers, digital tools and resources are now making it available and accessible and reachable. And then it's also, yeah, like you said, because it's been tightly held within Indigenous communities, now it's also being extended to non-Indigenous people as well, who could benefit from knowing, and benefit from this knowledge and knowing these things as well. That's amazing.
Yeah.
And so what kinds of things have kind of emerged on, how's that changed the landscape online? What kinds of things are popping up?
I guess in terms of the WellMob website, so a year ago we had 250 online resources. To now we've got over 300 resources that are Indigenous specific social and emotional wellbeing online resources. I guess that, continual growth over such a short amount of time has shown that there's definitely the need for it on the consumer end. So the consumer end would be on the ground, that's our community, our Aboriginal and Torres Strait Islander mob. But then also in the space that we're in of social and emotional wellbeing, it's for workers to be able to use these resources with their clients as well. So there's also, I think, that need is reflected as well in the growth of the number of resources that have been, created and developed by mob for our mob. It just keeps growing and growing. And there's amazing resources that, just keep coming out of community.
That sounds like huge growth. That was just a few months, really. If you said it was sort of from last year to this year.
Yeah.
That's incredible. So it's definitely meeting a huge need and responding strongly to it.
Yeah.
And that brings us to the WellMob website itself. We haven't really talked too much about it and what it does yet, and I'd love to go there now, just to give us some insight into the history of WellMob, like why it was initially developed, who it's for, and how it's evolved into what we see today.
Yeah, so I guess initially that need that I just spoke about, it was highlighted by the Aboriginal community workforce, health and community workforce, probably about 8 years ago now, where there was workshops teaching our frontline community workers to be able to search the internet and save online resources to then be able to use with their, patients and clients. And that was a really, really tricky and lengthy process because these amazing resources were hidden and tucked away through pages and pages of website content, very text-heavy content. It wasn't user-friendly. It was really hard to find. And the idea came from, this reference group and this workforce group. Why don't you put it all in one spot? And that's essentially what we did. So we were able to collate, these already existing resources all over the internet into this one space where it makes it easier for our workforce to be able to find these resources to use with their clients, but also for our mob. At the end of the day, there's a saying and it's called the Koori grapevine. I'm Koori, so I'm from New South Wales, but the Koori grapevine spreads that fast. You can find out something from the northern New South Wales to the border of Victoria like this before the news cycle, honestly. So we know that that word of mouth and that information sharing is done across our mob as well. And we've developed the website to be really easy to use. Within 3 clicks, once entering the website, you will find a really great social and emotional wellbeing resource.
Wow. So it's you listen to the needs of the workforce who are already kind of makeshifting their own solutions. And you created what they needed, and it sounds like it works really well.
Yeah, we always receive really positive feedback about WellMob. It's still growing in awareness amongst the workforce, non-Indigenous and Indigenous workforce, but also amongst our own community as well. That awareness is still growing, but as soon as someone hears about it, they think it's amazing, and then they start using it in their work. And one of those people was Beck. I met Beck when we presented to her counselling team end of last year. And there was a couple of people within that group that had heard of it, a couple of people that hadn't. And were you one of those? Had you heard of it, Beck?
No, I hadn't heard of it. No.
But then you did, and you started using it.
Straight onto it.
Yeah.
Onto it. Yeah. Yeah.
And that's the thing. Once you have that great experience of using it, you've really become a champion of it because it's an amazing resource hub.
Oh, it's so user-friendly too. Like it's just at the click of the fingertips, when something's intuitive and you're used to sort of diving through these, like getting, pages deep into stuff and not finding what you're looking for. With WellMob website, It really is. Every click takes you to where you're wanting to go. It's user friendly. It's amazing.
And I think as a non-Indigenous worker too, knowing that all those resources have been culturally vetted, they're deemed culturally safe and appropriate. You just have full confidence knowing that anything you find in there is going to be okay to use or consult. Yeah. And we were talking a bit before about some of the knowledge, the knowledge that is being, I guess it has been captured by some of these digital resources is really, important knowledge that being translated into the online format and put on WellMob to reach more people. I wanted to talk a bit about that knowledge and some of the knowledge gaps that we as health practitioners have in this area. So we know that to deliver effective and culturally safe care, we have to have a skilled and knowledgeable mental health workforce that actually empowers Aboriginal communities. So I wanted to ask you both what you have come to understand, through your work and through your own lived experience. What kinds of topics do health professionals need to find out more about when it comes to informing mental health care and cultural responsiveness?
It's a big question. And I think definitely from my perspective of lived experience as an Aboriginal woman, and also working in this space on the WellMob website, I'm sure Beck could probably answer similarly, but slightly differently as well. But I guess for me, it's as a worker, being able to really understand some of those outside determinants of health and social and emotional well-being and how that affects a person's those things that keep us feeling strong. So with the WellMob website, not only is it being, are you able to use it directly with your clients to show them videos that unpacks topics or issues in a way that they're able to relate to and feel safe viewing. But you can also, there's a whole bunch of training resources on there for practitioners and clinicians and health workers to, I guess, not only support the implementation of using digital tools in practice, but also helping to build cultural and historical understanding that can support how you can make your practice more culturally responsive and trauma informed. Those two things are really important, especially when working with Aboriginal and Torres Strait Islander clients and patients. And WellMob's actually got resources on there that sort of help unpack some of the impacts of colonisation. Like I mentioned about the social and emotional wellbeing video, there's other videos on there as well, or documents, and practicing trauma-informed care. And it is important to understand the ongoing impacts of colonisation and the former policies of segregation, assimilation, and the forced removal of children from families when working with Aboriginal and Torres Strait Islander people. That intergenerational or transgenerational trauma describes the impact of traumatic events experienced by my elders. These are people my dad and my grandparents' age. It's not that long ago, and it does impact my generation and the one after me as well. So racism is another enduring consequence of colonisation. It can contribute or add to current experiences of trauma, and racism may be individual, but it can also be systemic. And many formal mental health diagnoses don't reflect or name those impacts that are often underlying or contributing causes to many conditions. So WellMob features many online resources that enhance that understanding and support the health workforce awareness of how transgenerational trauma and healing that needs to be considered when working with today's, First Nations people.
Absolutely. I think that I've watched, quite a few of those videos, like they're, some of them are really not long at all, 10 minutes. They're really emotive and they really tell strong stories about the impacts of trauma, the impacts of colonisation, how trauma is passed down through generations. And I think it's so important for health workers to have a really strong grasp of how that works. Because there's, you hear the terms, you go, okay, yeah, I should be aware of that. But going to those resources, watching a video, hearing an Indigenous person tell a story and describe how that affects generation after generation, how it's transferred down, how something that happened, 40 years ago or 100 years ago has kind of rippled throughout the generations coming after that and will continue to. I think it's absolutely critical for us as health workers to understand. And I think that's a great benefit of the WellMob website in having those resources there. And Beck, in terms of that historical context, how does that translate for you in practice? What kinds of things do you see, and how do you, as a non-Indigenous health worker, how do you think differently about your Indigenous clients' wellbeing compared to your non-Indigenous clients? How does that come out in your work?
Look, I think firstly, just hearing Ange and yourself talk, it just really highlights my role as a learner, my role as, and we've talked about, I know Ange and I having a yarn the other day about cultural humility, really understanding that my role as a non-Indigenous health worker is to seek to understand and to find out more, and knowing that Indigenous specific services and Indigenous people, workers, and websites such as WellMob can go a long way to informing my practice and about the historical context. Like when I first came into health, we had the opportunity, we did some cultural training, and what we heard Indigenous elders speak around their experience of the health system that I was working in. And not that long ago, like Andrew was saying, Indigenous people were put in separate wards, like at the back, and they wore gowns that branded or labelled them as Indigenous, and then obviously their experience of racism and segregation and discrimination within the health system. They also spoke about this distrust of the hospital system, in that ancestors or relatives went in and didn't come out, and so that access to the health system and distrust is 100% based on that historical context and experiences in the past. And so it's acknowledging that to start with, and finding out more and people's experiences around that. And that informs my practice because, access to healthcare is a big deal in general, across the board. If people don't access the healthcare, and then therefore they may not be able to get the help they need. And so, when it comes to Indigenous clients, I'm looking at, how difficult it must be to access, to come in for that first appointment into a place where ancestors, relatives have had all these experiences that have caused trauma, and so so it's treading lightly around, having conversations on the phone, asking if they'd like a specific Indigenous worker, and once, chatting with someone, having a yarn, taking time. Like, it's really important to build that rapport with everyone. But I think as well, when there's that cultural, historical context around, the way that Indigenous peoples were treated in the health system, and that distrust, that valid distrust that they must have of the service, is spending time, listening to their experiences, listening to what their issue is. Also, trauma can often be mistaken for, and I don't use these words in my practice, and the WellMob resources actually have these beautiful resources on language and certain language to use that's culturally safe and appropriate, and words like non-compliance and lack of engagement, that are not appropriate words to use, and they often can be mistaken for trauma, and so it's understanding, like having the little knowledge that if someone finds it hard to come in, do you know what I mean, and not come to the first appointment or the second appointment, rather than going, oh, that's, they're not coming in.
It's lack of engagement.
Yeah, exactly. It's having conversations. How is it for you to come in? Is it, what can help? Like, is there a service maybe that might be more, there's Indigenous service, I know Lives Live Well and Rekindling the Spirit, not provide counselling. Maybe it is talking about that service. Maybe it is that they meet with one of those workers in our counselling rooms, and then maybe that service is more appropriate. It's about if they want to come in with someone, or so it's understanding that will lead me to ask those other questions. Yeah, it's also as well consulting. We have an Aboriginal counsellor who may not be at the service much longer, but moving on. But consulting. I'm doing cultural supervision reflection with her all the time, having a yarn about my client, you know, Indigenous clients, and whether what I'm doing is safe and culturally appropriate and responsive. And I think that speaks to that, what I spoke about before, about being a learner, you know, asking the questions and understanding that people are the, you know, experts on themselves, and that, you know, every client is individual as well, not generalizing as well. I think, myself included, is you can have a tendency to think, oh, you know, this suits Indigenous people, you know, but Indigenous people are individuals, like everyone are individuals, and certain things are going to be more appropriate for themselves. So it comes back to that deep listening, you know, that deep listening and yeah, and hearing, and being curious to find out what else is going on for the person as well. And I think as well, just, I know I'm speaking quite a long time, but you know, as Angela was talking about SUB, or social emotional wellbeing, it is very important that, you know, we recognise that drug and alcohol use is a symptom as well when it comes to misuse, and then there's a whole lot of background, you know, going on for a person when they resort to drug and alcohol to cope. And, you know, it's very important that multidimensional assessment, and when I say assessment, I don't mean ticking boxes, asking questions. I mean having a yarn, having a talk, you know, to someone, and listening deeply around what's it like at home, you know, what's it like with your connections with others, your social life, you know, like what strengths do you have, what do you find hard, like things like that, finding out a bit more of a holistic view of what's going on. And sometimes it's working on those things rather than the drug and alcohol, you know what I mean, that is actually going to take care of a lot of things when we look at the bigger picture that Angela was talking about before. Yeah.
100%. I love that, Beck.
Yeah, gosh, that, like, there's so much I want to unpack in that. There's, you know, it sounds like, you know, for you there's this, you know, deep, you know, it's about this deep respect for those clients and their stories, and respect for choice, you know, and self-determination, that it's not just you coming along and you're engaging or you're not, you know, and you know, here's the treatment, you know, it's real respect for their choices and their own expertise in their lives, and this really lovely, you know, just sitting and listening and connecting with people. And that, you know, really captures trauma-informed care, you know, where, you know, you switch from the what's wrong with this person to what's this person's story. Yeah,
100%. 100%. Yeah. And I think as well, you know, sharing knowledge as well, you know, if a person's coming in to see me and, you know, that they are going to share about themselves. I was speaking about this the other day to Angela. It's important that I share the processes of the health system and what it is today as well. You know, like, and I don't mean share of myself, because that would be inappropriate, or some parts about myself, but not everything. But share about the processes, you know, like when I talk about confidentiality, which I do in the first session with everyone, is, you know, I talk about, you know, in the medical records. Once I have access to their medical records, they're directly involved in my care. I can also see if they've been to hospital. Do you know what I mean? Like if they've gone to hospital with a bung knee or whatever, I can see that. And they can also see over there in ED that they're accessing drug and alcohol services. So I let them know that as well. You know, and a lot of clients are shocked to hear that, you know, that once they hear it, they're okay with it. Oh, I didn't know that, you know. That's interesting, because if I didn't share that, I feel like it's not being transparent, you know what I mean? Like I can see they've been to hospital, they've got a sore knee, and then I say, oh, you know, is everything okay? How's your knee? Like it's just not transparent. Yeah. So I think if I'm expecting someone to share knowledge with me about themselves, then I need to share knowledge as well about the health system today. And I hope that when I do that, that can go a way to creating that safety and trust and transparency, all those parts of trauma-informed care, that they can start to see, you know, a little bit of the health system that is informing their treatment and interventions that they're accessing, because we are of service, you know, it's our service, and they need to know about what the processes are. I think it's important.
It's like creating that true collaborative kind of relationship, rather than I'm the expert and, you know, you just, you know, come in and, you know, I'll take the lead here. It's this real, you know, beautiful you know, illustration of real collaboration with someone on their healthcare journey. I'm interested to hear more about trauma-informed care, Beck. how our understanding of the historical contexts can be incorporated into practice, to help maintain and strengthen social and emotional well-being. Because I'd love to hear more examples from your practice if you have any of how we as health professionals can start thinking about trauma-informed care with Indigenous clients.
Sure. And I think you just hit the nail on the head there as well, is that thinking about it is very important. Like it's so easy to just get swept up in the day-to-day what we do, that it's very important to understand that all, community services and health services, there's such a strong correlation, with trauma, especially with AOD. But it's also when we look at with Indigenous clients and the historical context, just understanding that there's trauma, there's transgenerational complex trauma. And so from the get-go, really starting to workshop, access resources, talk to Indigenous workers, but also from the top down as well. We have started implementing, we have an intake team. So before a client comes into the counselling caseload, they'll go through an intake process with a separate intake team. They've now got an Aboriginal worker that goes in and sits on those intakes of clients that are Indigenous, and also to inform, intake on what might be appropriate treatment interventions or culturally appropriate and safe ways of accessing the system, what might be needed, what they can do extra to maybe assist that person in accessing, and things like that. So that's an example, I think, is from the beginning process, because I think that can be lost sometimes in the intake process of the health system. So it's really great that we have that. Another example I have as well is, when we talk about historical context and we look at the stolen generation, and when we're looking at drug and alcohol issues, sometimes there is child protection issues, and we have mums and dads coming in. They've done the intake process, so that the knowledge is there around what they're using and how much they're using. And so it's understanding as well that Indigenous people's experience of the forced removal of children is going to create, is that the distrust of being able to access services, speak openly about their drug and alcohol issues, and having any resemblance of trust that someone's not going to swoop in and be like, oh, sorry, that's it, the child's removed. And so that can be a real barrier to treatment. And I've had clients, that come in and with reporting, I'm very open from the beginning about mandatory reporting and what that means, and really open up a space for questions around that and unpack that. And clients often have a lot of questions around that. And I do my best to answer all those questions really honestly, and that's hard, but to answer them really honestly. And I've had clients as well that when they come in, I can see that they're using and they're accessing treatment, and what they're using is we have an MRG. So basically, it's a decision tree, a mandatory reporting guide. It's not a report to DCJ or to child protection, but it's just a guide that workers can use to answer some questions around what they're using. Is there any significant risk? What's the protective factors? Things like that. And it comes out with a decision that's usually like, oh, yes, this needs to be reported, or it can be, and just as often, document and monitor. So basically you're just saying, yes, I have done an MIG. It's worked together with the family. So that's a really strong outcome. When that outcome comes out, and it often does, that's great. So I have clients that come in and they want to know about the reporting. Does this mean that you're going to ring child protection? Are you going to ring docs? What does that mean? I have, and so the distrust is there, and I can see there's discomfort there. There's been times when appropriate that I go through that mandatory reporting guide with the client. And that's sometimes been so, all the times that I've done that, it's been so useful because the client gets to see their protective factors, the fact that they're accessing services, the fact that they want to do something about the issues, the fact that they make space for, uncle, someone to look after their kids while they might be, using, the storage of their, drugs and alcohol when they're using and stuff like that. So when it's appropriate, I can go through that with them. That's another way that I can share knowledge from the health system and our processes. And then I can talk about how it comes out, document and monitor. This means we get to work together,
It's that collaboration again, the transparency.
And building trust as well.
And that knowledge, because they share on what they're, there's an expectation that they're going to share with me about their drug use, about things that might bring them shame and whatnot. And so I have to step out of my comfort zone too. It's easy for me to go back into my office and do the MRG. It comes out, document and monitor. That's it. It's all behind the scenes. But to be honest and step out of my comfort zone and going, this is the process we use and this is what it means. And, that's gone a long way with a lot of clients that I've used that with. And I think it speaks to, as well, sharing that knowledge of what the health system's like now. So it may be, hopefully, and I don't know whether it has the power to do this, but start some of that healing process around what people have experienced in the past of that swoop in and remove, forcibly remove children. So some different experience around that.
And that sounds like a big part of being culturally responsive in our practice is, like you said, stepping outside our comfort zones. Like this is how our Western, system is set up, and we have to step out of that to make this work and to step into what's safe and what's needed for our Indigenous clients. Like not just no, I don't normally talk through this bit, so we'll just skip.
It's having those uncomfortable conversations, and I think it goes a long way.
And I was just thinking too, obviously you're working in the public system, and a lot of these examples you're giving, can be applied to people working in other contexts as well. This idea of being aware of historical context. I love what you said before about realizing that symptoms are often a coping mechanism, a response to trauma. They're not, then we see them as diagnoses. Oh, they've got an addiction, they've got depression, and so many of these phenomenon are actually coping mechanisms to trauma. And if we're going to be really trauma informed, we need to see that, in people who come along, we need to, sit down and go, well, what was it that actually led to the development of that coping mechanism or whatever it is, and acknowledging that it might, the trauma might be something they directly experienced, but it could also be trauma from generations back, and just seeing through that lens, starting to see through that lens.
100%. And I think it's treating it like that as well is having, taking extended sessions. We work, we have 3 months where we work with people. We can apply for more time to work with people. And with Indigenous clients, I'm always applying for that more time in case reviews. It takes time for that trust to build, with all the background with the health system and whatnot, and that deep listening to be had too, that really taking time to understand what's going on for the person. So it's not going to be, straight onto the drug and alcohol, and you're drinking this much, and how can you drink this much, and what are your goals, and all that sort of stuff. It's really important to have that background view of what's going on in the background.
So coming back to the WellMob website, coming back to how we can then start actually implementing this in practice. We know now there's this knowledge there, these incredible resources available to us, but what's the bridging of that gap, the next step? How do we go from being more informed and more equipped with resources to actually making a difference and being more culturally responsive in our practice? Ange, have you got some thoughts there?
I think a lot of it is what Beck has spoken to. So what she does in her practice is, I feel as an Indigenous woman, I feel like it is very culturally responsive. And I hear what Beck's being able to do is, take the understanding that she has of the historical and cultural context, take that into how she considers working with her Indigenous clients. Like takes all of that into account, and that informs how she works with that client. So, I mean, I guess on from that, like Beck said, it's, approaching the work with the client with humility and curiosity, and acknowledging that you don't have all the answers, and really, taking time to create that reciprocal and collaborative relationship, of knowledge sharing and trust building and rapport building in that process. And, being able to build that cultural understanding and capacity to make your practice more culturally responsive. I think when we use the word culturally safe practice, from my perspective, the only people that can deem something culturally safe is, an Aboriginal or Torres Strait Islander person. So I think that, coming from that angle then of being culturally responsive and sensitive, and I mean the resources on WellMob, you're able to do that if you're using that in your session with your clients. It sort of takes all that think work out of it for you. As you said, Tania, like they've already been vetted to be cultural and deemed culturally safe and appropriate by our team of Aboriginal, project team here at WellMob. But, you're able to sort of take all of that guesswork out, because I could imagine, for a non-Indigenous clinician, everyone has this knowledge of the historical context of what's happened in this country. And it's sort of like, how do you go from having all of this knowledge and understanding, but like, what does that actually practically mean in your work then with an Aboriginal or Torres Strait Islander client? Like, what does that look like? And I think, there's some really great practical tips in some of the resources that we have on WellMob. I know that there's it's a handbook. It comes out of the Kimberley, but it is specifically for Aboriginal workers, social and emotional wellbeing workers. But when I was reading it, I could totally see that it would be, anyone could apply the principles that are in there. It goes through to unpack more deeply than what I've previously explained today about social emotional wellbeing, the domains, the determinants, but then it even goes further and deeper into, talking about the strengths of those domains and then the risks to those domains, and then what that looks like could look like in your work. So there's really amazing resources out there that can kind of help guide you through that next step from taking this knowledge that we've got as Australians and knowing what's happened in this country and how that has affected people, Aboriginal people today, but then taking it that next step of how do we implement that into our work to be more culturally responsive in our practice.
There's some wonderful resources as well going through the WellMob website around understanding generational trauma, and they're short videos, but they're just done, like, it's just so succinct and to the point. And there's also, when I was looking through the WellMob website, trauma-informed care, as I was trained around, and the training that I've done so far, like I saw a video, I think it was like 20, might have been less than 20 minutes, and it talked about the 5 R's, of like recognizing the widespread impact of trauma, responding, by building trauma-informed care into policies. And I just thought it was great. And it was Indigenous specific, and it talked about it in a completely different way. I never had access to that, and I probably wouldn't have had access to that without scrolling through that WellMob website, and I think that just goes a long way. And I'm thirsty for that knowledge. Do you know what I mean? It's like, until, I don't know, I haven't had access to that. And it is, and I love what you said, Ange, about it's deemed safe when Mob says it's safe, and then that goes a long way for my confidence to be able to use it, and therefore it frees up that space in the counselling room of that thinking and of wondering if I'm getting it right, and and the anxiety that can come with being a non-Indigenous worker, and doing my best with the knowledge that I have, but also, not having walked in those shoes, and so having access to that content, and some of the videos, like the grog brain story, like you should see me trying to talk about the brain. I'm like, there's a limbic, and it flips, and then go around, and like trying to, like,
and then it does this.
And that grog brain story, it just says it so simply, animated, great.
Goes for about 5 minutes, I think.
It's short.
And
it's short.
It's in, like, it's also in language, so it's in Warlpiri language as well as Creole. So, we've got resources on there that are in other languages that other than English, acknowledging that a lot of our other mobs, English might be their second or third language. So, being able to have information like the grog brain story, which is one of my favorite videos. When I first saw it, my mind was blown. I was doing, a health promotion degree, and it was like, wow, this is really impactful and meaningful. Like, I can see how this is, so useful for my mob to be able to see and understand. I have high health literacy. This was a few years ago. And even I didn't understand all of that stuff that happens to the brain when you drink. So it really then, I guess, worked on me in a health promotion sense. I could definitely see how that could be translated across different communities in,
I think it needs to be, because we all try to talk about the brain as therapists eventually, don't we? And it's like, it always ends up a little bit, how you going? So to have that and just go simple, to the point, it's a great resource.
Yeah.
Such
And
a great resource.
having a third party resource to look at too. So it's not you talking to your client and explaining about this. You know, you're watching something kind of independently. And then after the fact, you know, by removing yourself in that yarn about the brain, you're able to then both reflect on it and open up those conversations and, you know, ask your client, like, what did you think about that? Like what resonated with you, or what, you know, did you pick up on? And you can do the same as well. And there's that cross learnings again.
And it reiterates my role as a learner. It levels the power balance, doesn't it, as well? I love how you use the word third party resource. It's like, what do we think of that? And then the tricky topics as well. I know that WellMob's got tricky topics on there as well, that as well are difficult to talk about.
Issues that, you know, are stigmatized. And, you know, it's got videos on there that really unpack it in a very easy to digest way. It's not shame, you know, and nothing is shame, but there are certain things that have historically carried shame. So I think that by opening up these conversations, you know, through using a third party resource in session, it really destigmatizes it, and, you know, you're able to open up more honest conversations potentially.
Yeah, and that's trauma-informed care, isn't it? That collaborative sort of, no one's, you know, I'm not the expert. Let's have a look at something together and see what we think, you know?
So it sounds like there's so much on that. There's stuff that covers talking about mental health, well-being, social and emotional well-being topics, tricky topics. So to kind of facilitate the conversation with your client, there's also information on there for the workers and themselves to fill the knowledge gaps. Is there anything else we've missed there? Is there anything else in terms of the types of resources on there that can help?
So I guess the WellMob website essentially will match that social and emotional well-being framework. So we've got topics on there that are mind, body, culture, our mob, keeping safe and healing. And all of the resources are kind of grouped under those main topic tiles. As you said, we've got a section there for workers to be able to upskill not only in using digital mental health tools and resources in their practice, but then also unpacking some of those, you know, historical and cultural considerations as well, and learning that a bit deeper than just the general cultural awareness training you might get within your work roles or your organizations. And then, definitely the resources that are, I guess, aimed at our mob being the direct consumer. So, you know, health promotion tools and in-session work to, as we said, break down some of the stigmas and to open up conversations, but also to raise, you know, your clients' health literacy and help them understand a little bit more about what's happening for them, you know, through that deep listening you've already done. You're able to sort of get insight from that and then think, oh, I actually know this really great resource on the WellMob website. I'm going to show that to them next time, or, you know, something like that. So,
And it is about tailoring, you know, that once you know, there's some issues identified as well by the client, it's suggesting as well, like, oh, you know, what do you think of this? And then the feedback portion of that, and I learned that from the WellMob website as well. Like there was actually a direct resource on there that showed me how to use WellMob with clients, you know, like tailor the you know, the content for the client, ask them what they think about it, you know, give feedback, maybe next session, maybe the client would like to go through it in session, depending on their data or their access to technology, asking the client if that's something they want to do. Sometimes clients are like, no, I got this, I'm going to go, you know, I'll check that out later. You know, sometimes in session clients are, you know, I often find they say, I didn't think about it once I walked out the door, you know, what we talked about. So having that access to a resource that they can just scroll throughout the week and have, you know, get ideas and thoughts around, and then coming back and being able to talk about that is often a really good starting point for reflecting on the last session. And it's great. It's such a great resource.
So what's next then for WellMob? Are there any new tools or resources that we can look out for over the next few months?
So we are continually uploading new resources each month. And aside from that, we've actually just launched these new resource sheets, which are for workers. They're essentially a short list, like a shortcut to the best resources that are on the WellMob website. So as I said before, we've got over 300 and something resources at the moment. And even though we promote within 3 clicks, you'll find a culturally appropriate resource, the list is getting long. And we know that our workers, we're not time poor, but like we're under the pump. So to be able to make it even more accessible for workers to be able to use either for themselves in their PD, like with the building cultural capacity, or in session with their clients, we've created new resource sheets for workers. They're on a range of topics, and it's like sleep, anxiety, depression, parenting, cohort specific. So for LGBTQIA plus mob, within our mob, that intersectionality, which is a different cohort within itself, as well as suicide prevention. There's a couple of those, because it's important to not just for the person experiencing suicide ideation, but also for the families and communities that are supporting them. And there's resources that fit both of those groups as well, which is important to recognize and acknowledge. So these resource sheets, essentially, they are shortcuts to the best resources on WellMob for those topics.
Oh, fantastic.
The resource sheets I find really helpful as well. And I think what WellMob website does so well is there's something for everyone as well. You might have the younger client that might be more into like getting on YouTube video or, scrolling online themselves. And then you might have, someone more mature that might want a resource sheet. You know what I mean? I can print that off. It's so handy to print something off and give someone something to take away. That people really welcome that. I've found that when that's on offer, I can print that out for you. Would you like that? Yes. It's always like, yes, it's such a handy tool to have.
Yeah. And, we've also created resource sheets that are for workers' background knowledge. So what we've spoken today about, with the historical context of either impacts of colonisation or understanding social and emotional wellbeing and understanding trauma and healing, we've got those 3 resource sheets, which has got shortcuts to a series of resources for that topic. So if you're wanting to learn and find out more about what we've spoken about today, you can use those resource sheets to be able to do that. And they're found on our website under the training tab.
Okay, excellent. And we'll also include them in the show notes as well. I imagine we'll have lots of people wanting to check those out after hearing this episode. Fantastic. Oh, well, any final thoughts from either of you guys before we wrap things up?
You back?
Yeah, I'll go first. Look, I'm grateful. I'm grateful that we're talking about this stuff. I'm grateful that, when you came in, Ange, and did that in-service for us, there was a lot of stuff in there that I didn't know. I didn't know that Indigenous peoples were one of the, using technology. I remember that you said that using technology was really a high percentage of Indigenous peoples are onto the technology. And then that's something that would work for them. And then we'll just have these resources at my fingertips too. It goes a long way. Like I said, we can't always find an Indigenous worker to talk to, and they might not have time because they've got, my colleague's got massive caseload. So, do you mind, can we pop out, even though she always does, to have this really also takes the pressure off the workforce as well. You know what I mean? It's such an easy, culturally safe, by mob, for mob to access. And it gives me confidence in my practice. And I think when I have confidence in my practice as well, that leads to better trauma-informed care, better practice, better outcomes, And so I'm grateful. And I'm grateful that we're talking about this. I feel privileged to be a part of it.
Oh, thanks, Beck. And that's at the end of the day, what it's all about is better outcomes for our mob. I think that, regardless of what space you work in, so me in the project space and you, Beck, on the front lines, that's essentially, it's better outcomes for everyone in general, but our mob specifically when we're directly working with them.
Yeah, absolutely. A little bit of learning can go a long way, and I think that's better for everyone, better for outcomes, and in the long run. So I'm really glad we've been able to have this conversation too. Thanks so much, both of you, for sharing your experience and your knowledge. I hope we've opened up a really interesting dialogue around culturally responsive care and gotten people excited about accessing evidence-based, culturally safe, vetted resources. They're sitting right there. You guys have made them so easy to access. So yeah, please go and check them out. We encourage everyone to, to head to WellMob and look at what's available. So thank you. Oh,
sorry.
yeah.
Sorry. I was just going to add to also follow us on social media. Like Beck was saying, we acknowledge that we've got a high percentage of our Aboriginal and Torres Strait Islander community are a high percentage of Facebook users. So we really tap in to that social media space, and we've got quite a large presence on social and active presence on social media. We do regular posting, and a lot of that is, sort of further tips and insights into either how you can use digital tools in your practice, or, some of the culturally significant days, sort of resources and the background context around those days and why they are significant. And we write blogs for MPRAC as well.
Mm-hmm. Yeah, we get do a lot of great collaboration with you guys on our socials. So yeah, definitely jump on, follow, share things. Anyway, thanks again for joining us, guys. Thanks to our listeners for tuning in, and I hope you'll all join us on our next episode.
Thanks, Tania. Thanks, Beck.
Tania.
Guys.
Thanks, Ange.